Is there a difference in vaccine hesitancy provincially and nationally? A comparison of Saskatchewan social contours and COVID-19 study and Leisure COVID-19 Social Impacts Network survey. Vaccine hesitancy has been a growing public health concern, and the COVID-19 pandemic has added another layer of consideration. Throughout the pandemic, social perceptions of the COVID-19 vaccine have evolved with attitudes of COVID-19 virus itself, potentially impacting rates of vaccine hesitancy and refusal. As the greater public is access vaccination programs, gaining a better understanding of who may hesitate or refuse vaccines in both Saskatchewan and nationally can help create accessible immunization campaigns. The objectives of this study were to conduct analysis on Saskatchewan social contours and COVID-19 study data for sociodemographic, behavioral, and perceptual indicators of vaccine hesitancy. These findings were then compared with the Leisure COVID-19 and Social Impact Network survey indicators to determine whether there is a difference provincially and nationally for vaccine hesitancy and refusal, and to outline limitations of surveys. To better understand our question of whether there is a difference nationally and provincially in vaccine refusal and hesitancy rates, we devised a three-parts method. Firstly, a brief literature review sought to look at COVID-19 vaccination attitudes, what motivates vaccine acceptance, refusal, and hesitancy, and what role risk perception of COVID-19 other behavioral and perceptual factors impact an individual's decision to receive the COVID-19 vaccine. Next, to paint a picture of the provincial landscape of vaccine attitudes, survey data for from the Social Contour Survey, which is a longitudinal study, was used to conduct bivariate analysis on a number of factors that could further explain vaccine hesitancy and refusal rates in Saskatchewan. Lastly, this provincial data was compared to the National Leisure Survey, using thematic analysis of question language to identify parallel or adjacent questions or indicators. This helped look for similarities and differences in response patterns. So the Social Contour Survey had 5 rounds, first conducted in May to September 2020, with 5,354 participants, whereas the Leisure Survey was conducted in November 13th to 15th, 2020, with 1,522 participants. Both surveys had data weighed by the 2016 census for population representativeness, and both had participants over the age of 18. The question of interest for both surveys is related to vaccine receipt intentions. For the Social Contour Survey, that question is, if a vaccine were available, would you get it? For the Leisure Survey, that question of interest is, when a vaccine for COVID-19 that had been approved by Health Canada becomes available to the population, it is free, do you intend to get vaccinated? The findings show that 33% of Saskatchewan respondents did not intend to get vaccinated, whereas 30% of Canadian Leisure respondents didn't intend to get vaccinated. The Leisure Survey further divides up this vaccine hesitancy and refusal rates by region, and found that 41% of prairie respondents, that includes Saskatchewan and Manitoba, did not intend to get vaccinated, which is significantly higher than the 33% indicated in the Social Contour Survey. In comparing socio-demographic factors, we see that for the Social Contour Survey, males are more likely to not receive the COVID-19 vaccine. This is the opposite in the Leisure Survey, where females are more likely not to get vaccinated. Those aged 26 to 50 and 25 to 54 in both surveys had the greatest likelihood of not getting vaccinated. We see similar results in education levels for both surveys, with those with lesser education, so that's high school or less, had the greatest rates of vaccine hesitancy or refusal, whereas those with advanced professional degrees or a master's or PhD had lower levels of vaccine hesitancy and refusal. In comparing fear of COVID-19, the Social Contour Survey and the Leisure Survey have a similar pattern of results, where those believing not to get very sick at all from contracting COVID-19 in the social contour survey, and those that are not afraid at all of contracting COVID-19 have the greatest rates of vaccine hesitancy and refusal. In comparing employment status, we saw relatively the same amount of hesitancy and refusal for both survey participants, but there is a differentiation where students in the social contour survey were less vaccine hesitant or refused to get a vaccine than those in the leisure survey. To better understand respondents' beliefs of whether the federal and provincial government is taking appropriate measures to stop the spread of COVID-19, we did a comparison and saw that those who somewhat disagree or strongly disagree that the government, provincially or nationally, is not taking appropriate measures had higher rates of vaccine hesitancy and refusal, in addition to those that neither disagree or agree or just aren't satisfied with government response have the greatest rates of vaccine hesitancy and refusal. But we see that the social contour survey has marginally lower rates, except in the strongly agree category, where interestingly, even if individuals believe the Saskatchewan government has taken appropriate measures to stop the spread of COVID-19, they are still more likely to be vaccine hesitant or refuse the vaccine. Vaccine hesitancy is an old phenomenon that represents a serious threat to global health, and vaccine refusal and hesitancy is associated with lower levels of education, younger age, being a woman, and lower perceived severity of COVID-19. This is compared to vaccine acceptance, where greater perceived COVID-19 severity actually motivates vaccine acceptance, and higher education leads to greater risk perception, and additionally, old age, fear of COVID-19, being a male, and perceptions of local COVID-19 behaviors is associated with greater vaccine acceptance. And we see the opposite for vaccine refusal and hesitancy in the literature. Reasons in the literature to refuse a COVID-19 vaccine include perceptions of vaccine effectiveness and safety, and a lack of trust in vaccination programs. So we found many similarities between the two surveys, but the social contour survey edged out the leisure survey with a larger sample size showing greater statistical power to detect estimates, more data on COVID-19, especially for perceptual and behavioral factors that the leisure survey just didn't cover. And the social contour survey is a longitudinal panel survey, whereas the leisure survey is a cross-sectional poll, which alludes that the social contour survey is more representative of its population and better able to capture regional vaccine refusal and hesitancy rates that may not be captured at the national scale. A plethora of surveys and polls report Canadian COVID-19 response. What we did is we compared vaccine perceptions from a large provincial survey against a national survey and conclude that some findings are similar, as we saw in the findings, where others are dissimilar. Robust data from provincially based surveys may be more useful than national polling data in informing provincially implemented vaccine campaigns. Thank you.